Mr. Love for joining us and giving us some updates. We want to go ahead and get started since it's 1 o'clock, and I want to be respectful of everyone's time. And those, I'm sure there will be several people that will be joining us here soon, but I just wanted to introduce to everyone our speaker for today's conversation is Mr. Love. He is currently the President and Chief Executive Officer of DFW Hospital Council, which promotes collaboration, cooperation, and advocacy on behalf of 90 member hospitals. He told me to basically stop right there, but I'd like to read the first paragraph of his bio. He's very accomplished, and we're honored to have him. The Hospital Council has approximately 100 associate members, business and industry, including prominent accounting, legal, and consulting firms. The primary mission is to promote patient safety, quality health care, and coordination in delivery of healthcare within the North Texas market. He has served as the 2015 chair for the Conference of Metropolitan and Regional Hospital Associations in the United States. I'm going to turn things over to Mr. Stephen Love, who is going to provide us with some updates. After he's finished, we will be able to ask him some questions. Okay, so with that, Mr. Love, the floor is yours.
Thank you very much, Keyonda, and it's certainly a real privilege and a pleasure to speak to the Oak Cliff Chamber of Commerce, and I'm glad that we've got the people on board. You know, I did this for the North Dallas Regional Chamber last week, and I found that really the Q&A part was one of the most interesting and best parts, but KJ, I want to give you a little overview. Can everyone hear me okay? I hope you can.
You don't quit smacking in my ear.
Okay. I want to give you a little background. First, as mentioned, I'm President and CEO of the Hospital Council, and I've worked in hospitals my entire life. As far as this virus, though, I sat down with infectious disease physicians. I also sat down with what I would call epidemiologists, people that did modeling, the people that understood the science. So I wanted to give you a little background. When I sat down with some of the infectious disease physicians, I said, can you explain to me about the coronavirus? And they said, yes, the coronavirus is a family of viruses. The common cold is a coronavirus. There was a mutation from that became SARS, and that became the SARS virus. And then there was a further change, and it became MERS, the Middle East Respiratory Syndrome. And so that's why when this originally started, it was called a novel virus, a new virus. So let me tell you what the infectious disease people told me. Generally speaking, when you have a deviation in those viruses, they go to either some type of intermediary and then come back to the human. For example, the SARS virus went to a bat. It actually went to a bat, and then it was reinfected back into a human. The Middle East virus went to a camel, and from the camel, it came back. Now, they're not sure where this virus came from, and they're not sure if this virus, they know it has an intermediary. It has not been identified. Many are guessing it could be that, but they're not sure. So what does that mean? Well, what it really means, when this really gets into the system of the intermediary and then back to a human, we don't have antibodies to fight it. So it's a new virus. They finally named this the COVID-19 virus. Now, without antibodies, how do we fight it? That's why it spreads the way it does. And when I talk to the infectious disease specialists, they tell me this is 4 to 5 times more contagious than the flu. And it's a virus. So really, if you look at antibiotics, it doesn't have a real impact on it. So what they're trying to do is isolate what was the trigger that caused this, and can we develop a vaccine? Strangely enough, with SARS, a vaccine was eventually developed, but SARS pretty much ran its course and it was over. So one of the questions they have is this going to be a one and done type virus? Many feel it is not. Many feel that there's a chance it could recur. And if it does recur, that's why we need a vaccine. And many people wonder, when are we going to get the vaccine? Well, there's a lot of promising tests that are going on as we speak. Here's the thing. You can't just take a vaccine and put it in a complete population and hope it works. You have to do what's known as clinical trials. So when I talk to the people that really know this, and the infectious disease people and people from the CDC, what they tell me is the earliest we'll get a vaccine is probably going to be 8 months, because it's got to go through clinical trials. So, as you know, this started in Wuhan, China. It started the latter part of December, and it really started as a severe form of pneumonia. And from that, what they don't know is, where did it originate? They still don't know the intermediary. There's a big fish market in Wuhan, and there's actually some people that think, did this somehow come from fish, or was this some derivative of some kind of aquamarine life? And again, we don't know now, but they will find it. As you look across the different countries, from China to South Korea to Italy, even the United Kingdom, Iran, and now the US, each one is a little different. Each one is a little different. I talked to an epidemiologist who said, I really think one of the reasons Italy is having the amount of spread that they're having, and the amount of spread that they've got that is resulting in deaths, is because they have multi-generations living in the same house in many instances, the grandparents, the parents, the grandkids. So when you get an infection, it spreads rapidly. New York, as you know, you've seen on all the major news outlets, New York is having a real difficult time, but they're more densely populated in New York than, say, we are here in Texas. But one thing's for sure, all of the infectious disease physicians, the epidemiologists, and the people at the CDC are very worried because of the way it spread in China and it spread in Italy. So there's been a lot of modeling done, and there's a physician and an epidemiologist named Neil Ferguson, and he's at the Imperial College in London. And he has done a lot of scenarios related to what do we need to do and how do we think this will spread. And unfortunately, all of his models show significant spread and significant deaths. There's also some work that came out of that called COVID-19 modeling that really looks at estimated people that'll be infected, the age of the people, how many will be hospitalized, and how many will ultimately die. And unfortunately, all the models are a little different. But one thing's for sure, the models do show with increased infection, you're going to have more spread and more deaths. For that reason, the Dallas-Fort Worth Hospital Council 8 days ago contacted Governor Abbott. And we said, Governor Abbott, as of right now, hospitals, especially in North Texas, have the PPE, personal protective equipment, and we have the beds available. But we're very worried as we look at these models and we see this projected surge. We think we need to do everything we can to prevent the spread of this disease. So we requested the governor to do a statewide stay at home. Some people call it shelter in place. We kind of prefer stay at home, shelter in place. It's a little more like a tornado or a hurricane. As you know, the governor didn't do that. He said, I'm going to leave it up to each individual county and city, which is certainly his prerogative. But we said you're going to get a lot of inconsistencies and you aren't going to get the maximum push. Well, as you can see, it's spreading in Dallas County, even with stay at home, and it's spreading throughout Texas. So last Friday, we went back specifically to the governor and said, why don't you take your existing executive order, but let's add many of the things that we did in Dallas County. The essential businesses can remain open and define what they are. We have a 6-foot distancing, but we limit travel to essential travel. And also, and we've already seen this even with Dallas County's rule, and you can see that the County Judge Clay Jenkins is already making changes. We're recommending anyone 65 and older remain indoors. If they go outside to exercise, do it in a solitary manner, not in a group. Only essential visitors can go to nursing homes and senior living facilities. And essential visitors would be people like physicians or nurses, caregivers. And even those essential visitors have to be screened. They have to have their temperature taken. They have to wear a mask. The elderly should not use any form of public transportation except in an emergency. And then we wanted the governor to really address the young people, to specifically order them to please comply. We're going to continue to ask the governor to please expand it because we think it is so important that we do that statewide in a very consistent manner. Now, we did ask the governor for 2 other things. We said, would you please maximize the pull down from the federal government related to all the reimbursement to help the small businesses and to help other people within the state? And he said he would. The other thing we asked is nursing students who are going to graduate here in about 6 to 8 weeks have to complete clinical rotations in hospitals. Can they do that through virtual rotation and still get licensed so we can add them to the workforce? The reason they can't do clinical rotations in the hospital now is we have PPE that we're using very judiciously, and we're using it to treat patients. So therefore, we don't want to use it on students where it's just used for educational purposes. The governor did agree to that. So as you can see, we're monitoring the situation. What are hospitals doing? Well, there are 3 things when you have increased volume. The terminology we use in hospitals is if you have significant surge. We have at least 3 stages. Stage 1, you do everything you can to expand on your existing campus. For example, you're in Oak Cliff. We know the Methodist Health System, one of their main hospitals is in Oak Cliff. The first thing they would do would be try to expand on their own campus. Does that mean they put up a tent? It could be. Does it mean that maybe if clinically appropriate, they put 2 patients in one room as opposed to just 1 patient? They could. Since they have limited elective surgeries, is there a way to go to some of those surgery suites or surgery centers or some of the clinical suites and set up some hospital beds to increase their bed capacity? The reasons you like to do stage 1, by doing that on your campus, you already have your medical professionals there, your doctors, your nurses, your respiratory therapists. You already have your housekeeping and dietary staff. So all you're really doing is increasing the volume, but you're doing it within the footprint of what you're used to working with. Stage 2 in a surge is where you would look at maybe some closed medical facilities, previously hospitals, that you could quickly open up and use to house some type of patients. And it could be step-down patients. It might not be that you could put critically ill there, but it would help. Because not only are people coming to hospitals that have COVID-19, you still have people that have cardiovascular problems, diabetes, need life-saving surgery, etc. So we still have to continue the normal work in addition to this. The city and the county has to be involved, and that is just absolute. If you find a building that you can expand and put hospital beds in and reopen a facility, you want all of the codes waived. You don't want to have to sit there and worry about the city giving you a code and a license for occupancy. You don't need to wait and get the county to give you a permit to do something. They've got to be there to expedite and waive that so we can turn these around in 24 or 36 hours. And then you move to what we call stage 3. And stage 3 is where you really take a hospital and set it up inside another structure, like the convention center. Now, we're not in stage 3. The state did, and the federal government did say, we want a plan in case you do have surge in Dallas, and Dallas has the highest number of COVID cases now. So we're going to go ahead and set up that hospital. It's not operational, but it's going to be set up in the next 2 to 3 days. That would be used for surge if we needed it over and beyond what we have in stage 1 and stage 2. It's just coincidental that the federal government has already set that up in case we need it. Hospitals would prefer, if possible, to handle all the surge in stage 1, which means they do it on their existing campus. And if you look at Parkland, for example, they could put 2 patients in a room rather than 1. They have over 900 rooms. That could be quite a few patients. If Methodist did it, if Medical City did it, Baylor Scott and White, THR, and so on and so forth, that would help cover that surge. Now, with that said, what are some of the things we're currently looking at? We're looking every day, not only with Dallas County, but Tarrant County, Denton County, Collin County, Kaufman County, Grayson County, Wise County. Our hospitals go out about a 16 county area. We're working with their health departments, we're working with their county judges, and we're working with the people in the municipalities in the cities. For example, in the city of Dallas, we're working with Mayor Eric Johnson and his staff, in addition to the county judge Clay Jenkins and his staff. So it truly is a cooperative effort, but everyone has to know what the right and left hands are doing. And there has been a real collaboration. I think people are working to do their very best. Here's the deal from a hospital perspective. as we have an increase in volume, there's going to be more of a push on this PPE, surgical masks, the types of masks that people wear, the N95s, some of the outer garments they have to wear. There are certain rules about when you can wear them, how long you wear them, and if you can wear them for more than one patient. All of that comes into a very complex formula. That's what you're seeing in New York right now, where they're running out of some supplies. We're doing everything we can to backfill, stockpile, and be ready. But still, it's going to be a constraint on having the proper equipment and that protective gear to protect not only the workers and the first responders and the healthcare professionals, but also the patient and people that may have been exposed to the patient. That's it. The other thing, you've got to preserve your workforce. You know, you can expand the number of beds, but if you expand the number of beds, but you don't have the workforce, the doctors, the nurses, the respiratory therapists to take care of them, then you're going to have a problem. So workforce, equipment, and doing everything that we can to lessen the spread is going to help us tremendously. So what do we think? Well, let's look at Seattle. Seattle is where it originally came in a big way because it went through a retirement community and a nursing home. New York. I think New York is a hub of not only travel domestically, but international travel. And now we're about 2 weeks behind New York. Hopefully, some of the things we've done statewide, even though it's not as much as we wanted, and then what we've done countywide and citywide is going to lessen the infection rate. All we can ask people to do is to please comply, follow the distancing, wash your hands, do everything you can to practice good health habits to prevent the spread. And if we don't do that, then we are going to have a spike. And if we have a spike in infections, then unfortunately we're going to have a spike in the people that go to the hospital. Not everyone that's infected goes to the hospital. Right now, it's probably a 10 to 12% of the people that get infected go to hospitals. But if it continues to grow, then we're going to have a real issue on the volume of patients. So we're stressing, let's flatten that curve. Let's do everything we can to prevent the spread. Now, with that said, what are we learning from these other locations? We're learning a lot from New Orleans. We're learning a lot from New York, and we've learned a lot from Chicago and from Seattle, and with some of the healthcare workers. So it really is going to take a village. It's going to take all of us working together. We're going to have to do this in a very cooperative manner. And I know it's difficult. I know it's wrecking the economy. Our heart aches for the people that have small business. We feel very sorry for workers that are going to be out of work. But I think the first thing we have to do is look at the public health of the community and try to get through this health crisis, and then we can focus on rebuilding the economy. I'm going to stop there. I know I haven't been exactly as long, but I always like to allow a few minutes for questions. So with that said, I'll stop and be glad to take some questions. I've got some other comments, but I'll hold on those for now.
Mr. Love?
Yes.
Yeah, this is Janet Kane. NPR did a report over the weekend and indicated that some of the doctors that were involved and originally diagnosed as part of the Wuhan area had in fact been reinfected, or they had contracted the virus, and then they were cleared. Then they tested negative, and then later on tested positive again. And what you had mentioned earlier about recurring cases where that many think that that's a possibility. What do you think, or do you think that that impacts the current Dallas shelter-in-place status? And do you think that that's a possibility that that can be extended, or do you think it should be past the April 3rd deadline?
Yeah, that's a really good question, and your point's well taken. Again, I'm not an infectious disease doctor, but I've talked to many, and the CDC and some of the scientists are very concerned that once you have this, that based on what they're seeing, at least preliminarily, you may be able to get reinfected. And it may recur where you may have to have a flu shot and a COVID-19 shot in the future once they develop it. You know, it's really hard to project, but looking at the models, looking at the Penn model, looking at some of these models that have come out of some of the COVID research, looking at some of the work Neil Ferguson's done, here's the deal. I think it's probably going to hit here pretty hard in the next 2 to 3 weeks, depending on how much that is. There's probably a possibility that will be extended beyond April 30th. There are some that think it's going to peak here about mid-May. And if that's the case, it's probably going to go for at least till June 1. But it all depends on how the spread is. Dallas County continues to add new cases every day. So we know that the community spread is continuing. So I'm not really answering your question. I'm giving you my best guess. I think the order will be extended, probably, and I think we're going to peak towards the end of April up to the middle of May. But that's nothing more than an educated guess, but it's a great question.
Thank you.
You know, another question that we get frequently, and I'll wait for you to see if you have some more, is the warm weather going to help? Is the warm weather going to make a big difference? You know, I've asked several epidemiologists and I've asked infectious disease docs, and this isn't a flippant answer. They really don't know. They would like to think that it would, but they don't know. They said, we don't know what the impact's going to be, and we don't know if warm weather is really going to hold down the infection rates, and they also don't know if it's going to prevent or slow down the spread. There's more questions about this virus right now than there are answers. Other questions?
Yes, I'd like to ask about the Denton location. The school there, apparently they have a tremendous amount of infection going on there. What would cause something like that? I would figure that the farther out you are, the less likely you're to catch this disease.
Yeah, that's a good point. You know, some of the rural areas have not been infected. And so when you think in terms of Denton and moving out, you're moving more into rural areas. My discussions with the folks up in Denton County and the county judge and the health department there have been as follows. Someone did have the virus, and that's a close-knit community in that institution where those people are housed. And it's a state-supported institution. And unfortunately, the virus got in, so it infected quite a few. So even though it was out in more of a rural setting, the concentration of the people was much more intact. I'm not going to say it's like being on a cruise ship, but similar in the sense of the people were closer together. I know they've increased the testing. They're trying to see how many positives or presumptive positives they get, and then they want to isolate those people. This kind of, in a way, reminds me of a senior living or of of where you would have a skilled nursing and you'd have close proximity of people that get infected. But that's a very good question. How they're going to deal with that, I think, really depends as the tests come back. But that's been a large concentration of the positives in Denton County. That's a very good question. And now we've got two different senior livings in Dallas County that tend to have a higher concentration as well. Very good point. This is why schools were closed. This is why colleges have shut down and are going virtually, because of having people on the campus. Good question. Other questions?
Mr. Love, can you hear me?
Yes.
Okay, I was having some technical difficulties over here. While we're waiting for others to have or come up with questions, if they want to, if you want to continue with your other comments, and in the future, if folks have questions, if you would raise your hand and we can call on you as we go along, if that's okay.
Perfect. Well, while people are formulating their questions, you know, I've been in healthcare over 45 years, and I go back, I remember when we had to deal with Legionnaire's disease, you know, more recently, H1N1, of course, SARS. We will get through this. I will tell you, though, let me kind of compare and contrast this a little bit with when Ebola came to Dallas. You know, I know a lot of people got very upset about Ebola, as they should. Ebola had a mortality rate, according to the infectious disease physicians, of about 75%. But most people didn't realize Ebola was not as contagious as hepatitis C. Hepatitis C is actually more contagious than Ebola. But once you get Ebola, you better get immediate treatment or it could have a very high mortality rate. This is kind of the converse of that. What we're dealing with here is a highly contagious virus, but the mortality rate is not near as high. It's certainly not 75%. In fact, there are some people that think the mortality rate is more like 2% or 3%. Of course, we hear of the deaths, but what happens is you have such a higher infection rate. And I know a lot of people say, well, you know, 20,000 people die every year of the flu. Yeah, but that's looking at it on a year. Look how many people have died in just 3 weeks. I mean, if you annualize this over 12 months, the number of deaths would far exceed 20,000. And that's why it is so very serious. And it's something that we haven't dealt with. Now, I will tell you this, it's going to be interesting to see right here in the state of Texas, the only place they've done this in the U.S., in the Methodist Hospital down in Houston, not the Methodist Hospital here in Dallas, but the Methodist Hospital down in Houston. They actually took a patient who had COVID-19 and survived and made a recovery, and they took the blood plasma from that patient and put it in a critically ill patient with COVID-19 to see, will those antibodies in that plasma help fight off this, because the body has no natural immune system, and would this help supplement and fight off the disease? It just happened this weekend, so it's going to be interesting to see what happens. But that's another experiment and another tool that potentially could work. If it works well there, who's to say that, you know, those 98 people out of 100 that survive, could we get their blood plasma and use it until we get an effective vaccination or vaccine to prevent it, and use it as a treatment method? Too early to tell. When I mentioned blood, something else came to mind. the Red Cross and Carter Blood Care, as you know, have big blood drives, and they normally have blood drives at churches, at schools, at large employers. Well, they can't do that now because you can't have more than 10 people. So the other critical shortage we're facing now is because we're not having blood drives, we're having blood shortages. So any of you that can give blood, if you call Carter Blood Care, they have 26 locations throughout the Metroplex where you can make an appointment, and they won't book more than 10 people at a time. In fact, I think they book about 5. So you can come in and follow the 6-foot spacing, but you could give blood and leave. That's something else to consider in how you want to help the community. I'll stop there to see if anybody's raised their hand.
That's actually a great point, Steve. Is there anything else the members of the chamber can do to help the healthcare community?
Yeah, I'll tell you what else you can do to help the healthcare community. Not only could you schedule and give blood, but obviously follow the local ordinances of your city or municipality about not going out so you don't get contagious. The other thing that's so dangerous about this disease is many of the young people are healthy and have good not antibodies, but they have a good immune system. And they can fight this off, and they may show little or no symptoms, which is good, except they could still be a carrier and infect other people. So many of the infections that are occurring are people that aren't even exhibiting the symptoms. And that's what makes this even more scary. Other things you can do, Hamona, to the extent people want to help, if you can help in any way with helping with surgical masks or anything like that, or manufacturers, any support you can give would be good. I've seen a lot of good things on TV that people are doing. I think virtually communicate with each other. I think the young people do that pretty effectively anyway. But I also think that check on your neighbor, even if you just call and check on them. Make sure they're doing okay, especially if you have elderly in your community. I think we all just have to work through this. I mean, I know people have stayed at home for a week, and I've already talked to people that have cabin fever. And I just said this could go through the middle of May easily. So we got a long way to go. Any other questions? Here's a question.
Yeah,
Could healthcare providers use donated masks? Absolutely. They could use them. Any mask that you have you want to donate, they could certainly use. Now, they have to meet certain criteria, but even the masks that maybe they couldn't use to protect a patient or a healthcare worker, it may be good enough that the people working intake or admissions or doing things where they're not specifically around the patient, they could possibly use. So any mask you want to donate, it would be helpful.
And also, Mr. Love, it's talking about comfort masks. Can you tell us what a comfort mask is?
Yeah, comfort mask is a mask that you wear, and they call it comfort because it is a little more comfortable on the face, and it helps at least put the person at ease that they have the mask. And that comfort mask can be used in a variety of situations, and the clinical professionals have the rules and regulations by system on which situations they can and can't be used. Any other questions?
Yes. If we had masks or other medical supplies, how do we go about getting them from us to the places that need it?
You know, it's a great question. And I don't have a complete answer for you now. You could take it to your local hospital and, you know, I wouldn't go to the emergency room, but just go to the hospital and go to the intake and say, here's some masks and leave. The other thing, we're trying to work with Goodwill. Goodwill, believe it or not, has a great system of picking things up and delivering them. And we're trying, in fact, I got 3 emails while I was on this call from Goodwill on how they would like to pick up community donated PPE, surgical masks. It could be that we'll actually have someone from Goodwill that can come to your house and pick it up and distribute it. We're working on that as we speak. That's a great question. You know, I've had questions, how other parts of the country doing. I think some are doing better than others. I would say we're in much better shape than New York, but let's wait 2 to 3 weeks and see if we can still say that. You know, and a lot of people think, are we overreacting with the stay-at-home order? You know, that's difficult to say, but if we can prevent the spread and we save a life, it'd be well worth it. You know, somebody just put up, can you mention the advantage of taking supplements and vitamins? I'm glad you mentioned that. We have a radio show called The Human Side of Healthcare, and we had a physician on the other day, and she talked about during this crisis, get plenty of sleep, use vitamins, use supplements, and she was a vegetarian, so she was really promoting plant-based food and eating healthy so that you would keep your normal immune system as active as you could, and at the same time, hopefully ward off the virus if you did get infected with it. So I think get plenty of sleep, healthy eating, vitamin supplements, something that most internal medicine physicians are really asking people to do. Great question. Other questions?
Yeah.
You know, I think one other thing, and I think you have to look at how they're doing it. If you'll notice in New York, they docked a ship, but that ship's not really going to treat COVID-19. But what they are going to do is take a lot of the other health they're going to take the other health cases like cardiac problems, diabetes, labor and delivery, where they're going to deliver a lot of babies on that ship. That's going to be interesting. I just saw a question pop up I can't answer, and the question was, is iodine something that'll help? I don't have the answer, but I'll check with the physician to see, but I can't say whether it helps or doesn't help. Good question. Any other questions? Well, Kayonda, I may not have gone as long as you liked. I think we went about 45 minutes, but I do want to give you a little time too, because you do have some of your members on and you might have other business you want to cover. But I will certainly be glad to answer any final questions if there are any.
Well, first of all, thank you very much for making yourself available to us. Is there, or can you send us some information, everyone that's on the call, as to how to get some additional questions to you later on, should they have any, or if you want to send that directly to me and I send it to everyone on the call?
I'll do that. I'll send you my email. I'll definitely do that.
Okay, perfect. Okay, so again, thank you very much, Mr. Love, for doing this for us. Just a couple of, or just one major closing remark for everyone that's on the call. The Oak Cliff Chamber of Commerce has put together a resource page for those individuals that have been impacted by this virus, by COVID. The website is oakcliffchamber.org/COVID-19 COVID-19 /. Again, that's oakcliffchamber.org/COVID-19 /. And it has all kinds of resources for you that's there. If you notice that there's something that you need in terms of resources, if you would email us, we'll get some answers for you. But thank you all for being with us today. You have a great day. Enjoy it.